joined by Donovan Pyle. He is a nationally accredited health insurance and employee benefits expert, and he's going to talk about how to improve the financial and physical health of patients. Donovan, thanks so much for being here.
Thank you. It's my pleasure.
So we were talking off camera about the massive amount of waste in healthcare spending and unnecessary testing in our current system.
Yeah, it's pretty extraordinary. According to the latest studies, actually 25% of everything that we spend on health insurance and healthcare is considered waste. And on top of that, before COVID-19, the third leading cause of death was medical error.
Wow.
Right behind heart disease and cancer. So, bottom line in this, we have a cost and quality problem in this country.
So your expertise, what do? You work with employers, because that's really where most people are getting their insurances from their employer, right? To help kind of make smarter decisions about patient care and expenditures, right?
That's right. In order to solve these solutions that we have, we work, there are 150 million Americans that get their healthcare benefits through their employer. So that's the distribution channel that we work with. And, instead of just, selling these one-size-fits-all health insurance products that have, frankly, really contributed to the income inequality that we see in this country right now, we actually build high-performance plans from scratch. And what they do is they significantly reduce costs while improving access and quality to care for employees.
So one of the things that you encourage patients to do is to be an advocate for themselves and to actually audit their doctor, and there is a way they can do this. So let's talk about that.
Yeah, absolutely. So, the quality issue has become so bad that in 2012, the American Board for Internal Medicine, this is the governing body that actually issues boards for physicians in the U.S. They came out with a program called Choosing Wisely. Okay. And Choosing Wisely is basically a couple very basic questions that patients should ask to ensure that they're not wasting money and getting the best care possible.
So let's talk about the system itself. I don't want to say it's broken, but there's room for improvement, and that is the way we currently handle insurance and its relationship with physicians and care, right?
Yeah, there are a lot of misaligned incentives in our current system, and that's really at the core of the problems that we see today. So, a lot of health systems and private physician groups, they work in what's the old model, which is called fee-for-service, okay? And fee-for-service basically rewards them for ordering unnecessary tests and procedures. Okay, so that's a big challenge that's out there now. The industry is moving towards what's called value. A lot of challenges with that too, but the ABIM came out with these best practices that patients can use to reduce costs and improve care.
So let's talk a little bit about this patient audit. What are some questions that they can ask their doctor to be more of an advocate in their health care?
Okay, so very simple. There are 5 questions, and I had to write them down today.
Okay.
But the first one is, do I really need this procedure? Do I need this? And at the end of the day, patients are in charge of their treatment path. The doctors can recommend and prescribe their treatment path, but it's really up to patients to make the decision as to which way they go. Okay, and then number 2 is, what are the risks? Every treatment and test has some kind of risk associated with it. So it's really important for patients to understand what those risks are so that they can make informed decisions about their care.
Number 3.
Number 3, we're a few more to go. Ask your physician, are there simpler and safer options? Lots of the things that are prescribed, there are side effects. You may have to fast for a while. You may not be able to drive your car. You may not be able to go to work, et cetera, et cetera. So just ask your doctor, hey, is there something simpler and safer that I can do? Okay, is there a better option? Number 4, you'll love this. What happens if I don't do anything? Sometimes all the body needs is time to heal, depending on what's going on. So ask that question, what happens if I don't do anything? Maybe that's the way to go for me. And then lastly, this is a really important one, and so we were just talking about this off camera, but how much does it cost? right? We need to be consumers. I mean, we would never buy anything
Right.
outside of healthcare without knowing how much it costs. So it's important that you ask your physician, at least get a rough estimate of what it's actually going to cost to do what they're recommending. And now, to be fair, this is easier said than done because, every health plan has a different reimbursement rate for every health system, et cetera, et cetera. So it does take them a little bit of time to put together that quote for you, but you really need to hold them accountable and ask those kinds of questions so that they because physicians, they oftentimes, they don't know. They're a little bit in the dark on those things. So ask them. It's very important.
Well, Donovan, thank you so much. It's a lot of great information. Now, for more, you can check out the website on the bottom of the screen.